Our next presenter is Christina Macnamara, one of our social workers here. She's worked with us in the cutaneous clinic until just recently for many years, including helping us both with our children with melanoma in our kids clinic that we have every year and with our adults with melanoma. So she's done a lot of work with helping people at all stages, from the earliest to the most advanced stage, cope with the challenges of a melanoma diagnosis. Christina?
Hi, can you hear me okay? Perfect. So let's do Jane was much more quick than I in sharing the screen. I apologize for that, but let me give you a quick disclosure from myself. Yes, I have been a Moffitt employee just up until Friday. So at this time, AIM at Melanoma has graciously included me in the presentation with Moffitt as a private practitioner. So I'm here presenting as a private clinician here in Florida, but have, like Dr. Sondak said, many years of working with the medical team at Moffitt. And I've learned a lot about how challenging the melanoma and cancer experience is for our patients. So I kind of like this Zen picture. This is really shifting gears from all the science that my brain is still working on learning. Thought I'd start from the beginning when it comes to melanoma. To start with the new diagnosis, with a diagnosis of such a profound disease comes a lot of feelings. There's fear, there's shock, there's disbelief. People often have a lot of thoughts racing through their heads. Why me? How did this happen? What did I do? It is obviously a very stressful experience to have a life-threatening disease diagnosis and then trying to figure out what to do next. And so part of surviving melanoma and going through this process is finding ways to cope for yourself. So there are different methods that are highly recommended and have shown and been proven to reduce anxiety for others. For example, diaphragmatic breathing, that's deep belly breathing. I think you almost breathe to the point, for me, since I tend to be high energy, doing diaphragmatic breathing almost feels uncomfortable, taking a breath so deep that you just slow everything down. But if you stop and do that and do it a few times, let's say before you go to see the doctor, you're waiting in the waiting room. That's when anxiety tends to escalate. You're waiting for your scans. Do some deep belly breathing and you will reduce your anxiety. And that will not only just improve your mood, hopefully, but also improve your ability to remember and understand everything that you're being told by the physician. When we get anxious, we don't remember things as well. But when we reduce our anxiety, that will improve that. I'm sure you've all heard of meditation. They have apps for that. Actually, they have apps for diaphragmatic breathing as well, app for everything. So with meditation and guided imagery, the concept is not to empty your mind of thoughts, because I personally think that's nearly impossible unless you're, Zen Buddhist. But it is to disrupt those anxious and disruptive thoughts. So by slowing things down for yourself through a meditation or guided imagery, thinking about positive images, imagining yourself in a calm environment, that can reduce your anxiety, disrupt those negative thoughts, and just help you with your coping. Moderate exercise is proven to be beneficial to coping. It improves mood and it actually improves with fatigue. And it can sound kind of counterintuitive that how I'm too tired from my treatment to go exercise. How can exercise actually improve this fatigue? Well, it does. And you don't have to go out and run a 10-mile run, but you can go for a walk, or frankly, now you can pop on a YouTube video and they have options for people like low impact yoga, exercises, chair yoga, things like that, can keep you moving, boost your mood, and be of a good physical support for you. Also, part of coping is talking things out. Talk to your medical team about your concerns. You know, every cancer center, every NCI cancer center has a distress scale. You guys hear it every time you go and see into the clinic. You're asked to rate your pain, you're asked to rate your distress, and so forth. Be honest. That's not the time to tough things out, and not only about your physical symptoms, but any kind of psychosocial issues you may be having. If you're finding that you have increased feelings of depression or anxiety, you know, talk with your physician about this, because, you know, you may benefit from medication like an antidepressant or an anti-anxiety medication to help take the edge off and assist with coping. You may benefit from a referral to a therapist. To some individual counseling could be beneficial. And most cancer centers will have a social worker in the clinic to be available to you. So, for example, to provide supportive counseling, resource referral. You know, cancer is a fiscally draining experience. It can impact your financial stability, and whether because of work, because of insurance limitations, whatever impacts you, a social worker is able to provide you some resources that may help you with financial needs also. The social impact of having melanoma, coping with chronic disease, life-threatening cancer, it can be overwhelming. And I always encourage people to talk to others. So there are support groups in person, mostly online, honestly, anymore. Peer supports. Immerman Angels does a one-on-one peer mentor program, and AIM at Melanoma has peer support as well. I really like the quote by Thomas Jefferson, where he says, "Who better to soften the wound of another than he who has suffered the wound himself?" I hear people say, "Oh, I'm not a group person, and you know, I don't know if I really want to talk to other people about my, you know, what's going on." You know, you may find that it's empowering and encouraging to share your experience with others, because unless someone has actually gone through what you've gone through, the scans, the tests, the multiple treatments, okay, you're done with this, now you got to start that they don't truly empathize. And I did pop into the chat a little bit to see what some folks were talking about. I suspect there's some caregivers on this joining us today as well. And Immerman Angels and support groups have caregiver components as well. So if you're a caregiver for a loved one who has a melanoma diagnosis, they have caregiver support, whether it's in support groups or one-on-one through Immerman Angels and so forth. And it can be a tremendous support to talk to others who do truly understand what you're going through. And wanted to touch upon adolescent and young adults with cancer. It's called AYA. They are impacted differently than those who are older with the cancer diagnosis, because they're in a different and very active stage of their lives. It's a life interrupted when they get a cancer diagnosis. And the ages of AYA are considered 15 to 39 on average. And that's the age when you're finishing up high school, you know, looking for universities. Maybe you've graduated university and you're starting your career, having children, getting married, all that huge growth that you're going through in your young adulthood. And then to get a cancer diagnosis and have this life-threatening disease, it just stops everything. And it can be challenging in ways that are unique compared to those who are older. So there are groups out there for AYA folks. Moffitt has an AYA program. We have a navigator that helps our young patients, you know, maneuver the institution and get them resources for their diagnosis. Of course, social workers that assist with that. Cancer.gov is a great website, and they have pages dedicated to the AYA population, providing lists of resources and other links to other websites that are specific for the AYA groups. Livestrong.com, they have dedicated a significant portion of their website also to the AYA population. And they have some video testimonials of young adults talking about their experience. And I think that by relaying what they've gone through, it helps others see that, you're not alone. These are huge challenges, but they can be challenges that you learn to live with and cope with. So when you have this life interrupted, it changes everything. If your identity has been as a student or as this up and comer at work, and now you have to maybe take a semester off of school, can't enroll in university like you thought, and you get off the fast track because you have to undergo treatments, surgeries, radiation, immunotherapy, so forth. That's very disruptive, of course. And then there may come the process of thinking of what your new identity is. And your new identity doesn't have to be just, I'm a cancer survivor, I'm a melanoma patient. It can be more than that. And it can be an opportunity to think about yourself in new ways. Often cancer patients have told me how having this traumatic experience has caused them to reevaluate goals that they've had, reevaluate relationships, reevaluate who they are. So there can be a new identity that evolves from having a cancer melanoma diagnosis and undergoing the experiences that you do. So then you may be considering a new career. You may be considering giving back to the community, volunteering. We have a robust volunteer program at Moffitt of previous cancer patients who want to give back. Maybe you weren't in school, but now you want to go back. And so there's a website called cancerandcareers.org. I'm going to throw that out there because they have wonderful information about how to work while you're undergoing cancer treatment, how to find new work once you've undergone cancer treatment, and just your rights as employees that maybe you hadn't thought of before you had to go through all of this. So I'm ending with the statement that I really enjoy. Courage does not always roar. Sometimes courage is the quiet voice at the end of the day saying, I will try again tomorrow. Melanoma, it's not a one and done. It's an ongoing challenge. It has a chronic disease for a lot of folks, and it means getting up every day and finding a way to get through each day, which I believe is completely doable, and encourage all of you to keep reaching out, participate in things like AIM at Melanoma, talk to your teams, reach out to your peers, because there's support out there for you through all this. That's it. I went really fast, didn't I? Sorry.
You did great. Thank you very much. That was inspiring, and I hope helpful to a lot of people. We're seeing the stories out there, and we're so thankful that all of you have joined us from so many different parts of the country, so many different backgrounds, so many different experiences.